Hi, everybody. Welcome to Masterclass number 4, Reading Between the Lines, Address Literacy to Improve Health Outcomes by Alyssa Hobart. Alyssa is the director of the Mississippi Campaign for Grade Level Reading, and in this role, she leads and supports community coalitions where local stakeholders collaborate to implement effective, sustainable programs and initiatives. They want to ensure that all students are proficient readers. Alyssa is uniquely qualified to talk to us about reading and literacy. You really are, because she also held positions previous to her current position. She was an elementary school teacher, and that's where all of us learn to read. And she was a literacy coach with the Mississippi Department of Education. She also began her career with a program that I love and support very actively. She worked with Teach for America. She was a member here in Mississippi. So Alyssa's masterclass is going to help all of you understand the relationship between literacy and health. Literacy skills like reading and numeracy are essential to patient activation and engagement. Providers need to have patients who know how to engage with them actively, and literacy is a big piece of that. Low literacy, folks, I want all of you to know that low literacy and low health literacy are two completely different constructs. It's very unfortunate in most of the medical, public health, and health professions literature, just for all of you to know that these terms are used interchangeably, and oftentimes when you read research, what really has been investigated has been the literacy skills and not the health literacy skills. So I'm not going to get into all of that. That's Alyssa's role here today, but I want to also share with you that low health literacy limits one's ability to engage with the social determinants of health. Really, low literacy impairs every area of your life. If you think about the social determinants of health through the lens of Healthy People 2030, then what are we looking at? So we're looking at, for example, transportation. If you can't read, you can't travel. You are confined to your own area where you know what the streets are. You don't have to read street signs. Civic engagement is another important social determinant of health. Well, folks, if you don't read, you can't vote. Access to a quality education. If you have low literacy, you can't advance and go to graduate school. You may not even complete high school. So again, the social determinants of health, literacy, health literacy are rolled together. And Alyssa is here to demystify this for us today. So, Alyssa, thank you for joining me.
Absolutely. Thank you, Laura, for that great introduction.
Absolutely.
So, I'm excited to be with all of you today to talk about how powerful the connection is between literacy and health outcomes, especially in the Southeast region. So, let's get started. So, we have 4 goals for today. We're going to understand how literacy impacts health outcomes, and we're also going to look at the literacy landscape in the Southeast just to kind of give us a perspective about what does that actually look like. We're going to debunk some common myths about both literacy and health literacy. We're going to identify signs that can suggest low literacy levels when you're interacting with patients. And we're also going to learn some practical strategies that you can apply to improve both literacy and health outcomes. So I wanted us to start with just a simple reflection question. And I want you all to think about, how does literacy impact your daily life, personally and maybe even professionally? So think about that for a second. How does literacy impact your daily life?
I can tell you how it impacts my apps. Since I would be lost without my phone. Let's talk about how well people who have low literacy can navigate life if they have a smartphone and they can't use it for anything more than gaming.
Mm-hmm.
Think about all of the records that you keep on your phone, appointments that you keep on your phone. I wake up every morning. I work remotely at home. So I set my Zoom meetings. That's the first thing I do every morning. I go to my calendar. That's on my phone. Yep. Set my Zoom meetings. I set an alarm so that I don't miss any of them. So I wouldn't be able to function if I couldn't read.
Absolutely. Yes. Literacy impacts everything, right? It really everything you do from the moment you wake up to the time you go to bed, just personally, then in any professional capacity, no matter what your job is. Anytime you need to read, anytime you're having to understand directions or instructions, understanding and being able to communicate clearly also involves literacy. So it impacts all of us every single day. And often it's something we take for, especially as adults, we don't think about how often literacy and our ability to read is what's making everything possible for us. So it's something that impacts all of us, and it's something that all of us have an obligation to do something about. So as we move through this presentation, I want you to kind of just keep that in the back of your mind, how in every single interaction and activity you do throughout your daily life, how much of that is dependent on your ability to read and be a literate adult.
So, I'm going to add a point to what you just said. So we have two audiences for this training. So we have students who are enrolled in professional schools, who are in graduate school, medical school, nursing school. We also, for our second audience, are planning to reach out and provide this training to health professionals. So physicians and nurses and athletic trainers and dietitians. Folks, if you don't have a list of literacy programs, adult reading programs that you can make referrals to, just like you make referrals to other professionals, that's a new list maybe to add to your practice. And for students to know that, again, as you enter practice, you're going to be establishing your habits and they're going to stay with you mostly for a lifetime in your career. Your knowledge will continue to increase as a professional, that oftentimes the skills that we develop in training are the skills that we rely upon. So remember to include literacy and reading, because as we're going to discover, the prevalence of low literacy skills in the U.S. and especially in the Southeast region, very low. Absolutely. That's my commercial, but it's just something I'm passionate about in the work that I do. And I found that as a registered dietitian, Alyssa, that I had patients who couldn't read and I didn't know where to recommend that they go.
Yes, absolutely. And we're going to get to that, I promise. So let's continue and kind of talk about why is literacy important. We kind of alluded to it this morning, but when we think about literacy, I want you to think about it including reading, writing, your ability to comprehend what you're reading, what you may be writing, and even communication. It impacts our ability to make sense of the world. So it impacts all of us. And so literacy, it's foundational. It shapes our life outcomes, including what level of employment and what job can you have, how much money you make, your income, your life earnings, and of course, it impacts your health. So when individuals have low literacy, it limits their opportunities. And so we start to see how that can contribute to broader societal issues, including economic growth, public health, safety in communities, and like you already mentioned, civic engagement, being able to take part of the world around you. So it impacts everything. This is one of my favorite things to include no matter what audience I'm talking to. And it always is profound to me every time I see it. But there is an economic impact of illiteracy. And so according to the Barbara Bush Foundation for Family Literacy, the nation could be losing up to $2.2 trillion annually.
You said trillion with a T. I just want to make sure everyone. I can't in my mind. I don't even know what that might look like.
It's hard to conceptualize or wrap your head around. Absolutely. Due to low adult literacy rates.
Yeah.
That's astounding.
I look at the budget cuts that we're undergoing currently and think, oh, I would take just 1 trillion of that, more than $2 trillion, and use that, to keep some programs afloat.
So, yeah. So this is huge because guess what? That impacts all of us. It comes at a significant financial cost. And it's an economic burden that actually we're all kind of carrying, especially in healthcare.
And don't you think people who aren't literate, there's an emotional cost, there's a social cost. We don't add that in. It doesn't mean burden, it doesn't have that.
The whole picture. Yep. But sometimes numbers speak to lots of different audiences, and so it helps make it relevant no matter what sector or what field you're in.
True. Yeah.
So literacy has kind of become a national conversation. And of course, Laura and I are very invested in this and have been for a long time. But it's really exciting to see really recently, and not just recently, but the attention it's been getting across sectors. So the policy sector, not just the education sector, in healthcare as well. So I have two examples here that I wanted just to talk about. So the first one was Emily Hanford's podcast, called Still the Story. So Emily is an investigative journalist. So it's really engaging to listen to no matter what your background is. And I think anybody who cares about children and education, which is all of us,
right,
really should listen to it. It brought attention to the debate about how reading has been taught in schools. You hear from parents, children, adults with low literacy levels in a variety of professions. So also just want to throw that back there. You can be a high achieving adult and actually still have a low or lower literacy level than most people might expect.
right.
And you hear about their life experiences while also learning about how, according to science and research, we know how to teach children how to read, but there's been that gap in what's actually been happening in schools. Now, a lot of schools are starting to make that turn, especially here in Mississippi. But if you kind of want to know that backstory, I really encourage you to listen to this whole story. The second example, which Laura and I have talked about just a little bit, is called the film Sentenced. This film is incredibly moving, and it was produced by an organization called the Children's Literacy Project. And it's a firsthand look at how illiteracy affects adults. So you follow 4 adults throughout the film, and you see kind of the generational poverty and just what their life looks like as an individual who is not a proficient reader.
Right.
And what's cool is that it was actually executively produced and narrated by Stephen Curry. So again, all sectors, including basketball stars, are getting behind literacy and investing in it because they know how important it is.
It would call this film powerful. I mean, it is powerful. It is impactful. It really is life-changing. And if literacy and reading and the other associated skills are concepts that you don't think about very often. And again, we're talking to folks who have largely focused on science, all right? Because to be a good health professional and competent, you have to understand science. And a lot of these folks have been taking extra science classes since they realized they wanted to go into healthcare or they realized they loved science. So they've tracked in a very different way. Yeah. And this is why it's so important to bring the message that you're bringing this morning. When I've delivered these kinds of presentations to the College of Medicine, where I am a faculty member, the students they're just dumbstruck almost because they know it's important. We all know reading and literacy are important, but it's just something we don't think about. So you're putting it on our radar now.
Yes. And in that film, even, it's all 4 of the individuals. Actually, you see how their health was impacted, or whether it's their chronic illness, like the limited access to care, and just overall poor health outcomes. So that connection is prevalent throughout that entire film too, which is really interesting and something I didn't even think about until we connected and I realized it's right there in your face.
Well, there you are in the College of Education, and it's why are you contacting me? You're in healthcare. I mean, healthcare and literacy and reading literacy. We don't connect that often, but we should.
Yes.
So for all of those who are in practice, I want you to think about those patients that struggle the most, okay, to follow through with whatever care plan is developed. Have you ever wondered if literacy could be part of the problem or maybe the problem?
Yep. Wow. Apps. So, with that in mind, I kind of have another reflective question, and this is just interesting for me to always hear. But when you think about literacy, like you said, since we're working with healthcare professionals here, when you think about literacy, especially in the Southeast United States, what words or phrases come to mind? What do you think about when you think about literacy in the Southeast? Or what do you think people usually say?
Really interesting. I would think that people think it's lower just because there's, I think, a bias from other parts of our nation toward the South and kind of a caricature in terms of the Southerner that people think about or that comes to mind.
Absolutely, Laura. I think you hit the nail on the head. That's usually what I hear too. And so there is some truth to that. We do have some of the lowest literacy rates. However, and some challenges, but there's also been tremendous opportunities for change. And what we're going to get to is what that growth has actually looked like.
Mississippi is knocking it out of the park. So, folks, you're going to learn about what they're doing in Mississippi. Be inspired, and you're going to have a model that you can implement where you live as well.
Yes. So kind of changing that narrative, and not even just from Mississippi, but other states in the South are actually leading this literacy almost revival and seeing great improvements. So I think most people don't know that or see in that way, even people within the South. So pay attention so then you can kind of correct that when you do that. But just to start off, let's start off by looking at graduation rates. So according to the National Center for Education Statistics, this is the most recent one they have, which is looking at the 21 to 22 school year. So a few years ago. But nationally, the graduation rate is up to 87%, which is 7% higher than the previous decade.
That's great.
So again, we are starting to move in that right direction. And you see a snapshot here of our states in the Southeast region. These numbers can be a proxy for broadened literacy levels, since education and literacy can be closely connected. However, I do like to state that graduating from high school does not always necessarily mean someone is reading on grade level or able to understand complex documents like insurance forms or medical instructions from their doctor. So it's really exciting to see this improvement. And just to see that some states in the Southeast, a significant amount of them are actually on par with the national average. But we still have just a couple, Georgia and the Carolinas, that are almost there. So I'm hopeful to see the next time this comes out. Again, this was 21 to 22. I know there's been some improvement since then.
I'm really glad you made that distinction between formal education and your skill set. Because in healthcare, when you think, Alyssa, about the forms you fill out, when you see providers, and I'm using that as a catch-all term for physicians and physical therapists and everybody, you always fill out forms. One of the questions is highest grade of formal education completed. We in healthcare don't usually do anything with that information. Also, it's demographic information that we collect. We should be looking at it, and I know we're going to look at it differently after you finish your presentation. But here's something we don't think about, too, and I know you didn't mention it, so that's why I'm going to call it to our attention. Undiagnosed learning disabilities. I can't tell you how many students I have seen at the university setting for both undergraduate students as well as students in professional schools, and I'll include the College of Medicine in my discussion, who they love to learn, and they're very intelligent, and they learn well, they learn quickly, but their performance is still not what you would expect based upon their ability. So you just said graduation doesn't mean you're going to be able to have all the literacy skills, maybe to even read at grade level. There could be something undiagnosed. And so I know that's not in the scope of today, but I'm putting that on the radar, especially of those who are in practice, to consider.
Absolutely. Because oftentimes, even within education, we kind of think that our goal is that we want them to graduate so that they can go into the world prepared, which I think we're doing a good job at, and we've made improvements. But even then, we know that first round of success, there are still challenges that come with that. Absolutely. So let's dig a little deeper. So 21% of U.S. adults, and I put the number in 43 million because sometimes when you see the percentage, it doesn't always hit home, right?
Same thing.
So
right.
I like to say 33 million adults in the U.S., so not just the Southeast, the whole United States, have low literacy skills.
Wow. It's a lot of people. Yeah.
And again, they may even have advanced degrees, but because that still have the literacy languages, right? So it's important to put that into perspective. 43 million is a lot. And you're encountering them nearly everywhere.
And there were signs. Yeah. See, that's the thing. And again, in healthcare, we give the physical information, the clinical information. We get social and historical information. But people don't wear signs on their foreheads, so they may not know to tell us something. And we don't talk about literacy and reading when you're in a healthcare setting.
Yeah.
So, yeah.
And often, like you kind of alluded to before, that's not always something you want to admit.
A lot of stigma. Stigma is very powerful.
Absolutely. And so the Southeast states do have some of the lowest reading proficiency levels for adults. However, I'm going to give us kind of that glimmer of hope. What's coming up? What has really been happening in schools and in education for some of our youngest learners here in the South? So I wanted to include the NAEP data, which is the National Assessment of Educational Progress. Sometimes you might have heard it referred to as the nation's report card, which puts it into a perspective like that, right? The NAEP assessment measures what U.S. students know and can do in various subjects, but we're going to focus in, obviously, on fourth grade reading scores because it's a critical milestone, right? And again, actually, people outside of education use this data too across multiple sectors.
So tell our audiences why fourth grade is so critical.
So research shows us that students who are not proficient in reading by the end of third or fourth grade are significantly more likely to struggle throughout school and into adulthood. Fourth grade is kind of a transitional year in the classroom. You go from learning to read to reading to learn, which is what most of us do on a daily basis. Right. We're reading things to learn, reading the news, reading our emails, reading the form at the medical office and figuring out what they're actually asking.
Hey, you know what? It takes place in all academic subjects because you start to see in math word problems. You remember the trains. One train reads a station and it's going X miles an hour and it has this distance to travel and the other one is going. So where are they going to intersect? Fourth grade.
Yep. Right. Absolutely. And again, that's why it's such a critical point and why typically if you're not reading on grade level by the end of fourth grade, you're going to see that struggle typically across subjects, including science, math, and even health education.
Right. And then learning's not fun.
Yeah.
And so why stay in school?
When you know you're not, nobody likes to do things they're not good at. There are lots of things I'm not good at that I don't enjoy. Some I need to do more of, but you're less likely to engage in it or have a positive attitude about it because you equate that with how you view yourself.
Exactly.
So I also wanted to include that actually one of the leading health indicators for Healthy People 2030 is actually to increase the proportion of fourth grade readers with reading skills at or above the proficient level. And what they mean by that is they're looking at these NAEP scores. That's what they're using as their metric to broadly across the United States figure out if we're doing that. So again, this data, this information is impacting many, many things across our country. But let's look at them. So what I have in here, and you'll see some of our Southeast states have promising NAEP scores, but let's just start at the national level. So I want to start on the far right-hand column because we look at the percentage of students that are at or above proficiency, which is what our goal is. You want to be a proficient reader. That's that grade level. Nationally, so most recent 2024 scores, only 30% of fourth graders were at that level.
Wow.
Which means 70% were not.
That's mind-boggling. Wow.
Yes.
Yeah.
However, when we look at our states in the Southeast, we see that some of our states are actually at or above that, which most people don't assume. They assume, well, it's at the bottom of the. And that Florida and Mississippi, when we just look at the score, their scores are actually significantly higher than the national public. So, well, I know you're from Florida, so Florida and Mississippi are actually significantly higher than the public or the national average, which is really encouraging to see. And again, it's not something we hear about. So the rankings are also based off of the average score and the included achievement level percentages. So Mississippi is number 9. We have Florida right behind at 10, Kentucky at 11. If you just look there, most of those southeastern states, they're not at the bottom.
They're in the middle of the upper. Right. Huh? That's good news. We still have work to do, but it's good. It doesn't fit the stereotypes.
And so, but again, to me, it has an incredible call to the sense of urgency we have because it's more than an education issue. It's a signal for public health and forecast some of the future challenges or improvements we might see achieved.
Right.
So let's dig a little deeper into Mississippi.
Okay.
So this is from the 74. And so what we're kind of looking at is nationally in fourth grade reading, the scores of the top 10% of students have actually fallen half a point between 2013 to 2024. And the scores of the bottom 10% of our students, so our lowest performing students, has fallen 15 points national.
Oh my goodness.
However, Mississippi is our outlier. So this chart here looks at it on a state level. And I know it's a little hard to see, but if you look on the far right, you see that red bar. Mississippi is the outlier because from 2013 to 2024, our scores for our lowest 10% of students have actually increased. So we are both not just raising the overall bar for performance,
right,
but we're also raising the floor. And that's what our subgroups are excelling. And we're going to dig into that a little bit more. But I think this is really hopeful.
Right.
And to never improve. Yes. It validates the work that we've been doing. Again, it's not just for some, but it's for all students. And it's actually those performance. So now you saw in my article, they call it a Mississippi miracle. We do not actually love that here in Mississippi because it wasn't a miracle. It wasn't a shot.
It was planned.
Right? And it wasn't impossible. We knew our students and our teachers, they can do this.
Right. And you are doing it.
Yes, I've done everything here doing it. We're not done yet. It's still got a lot of work to do. But in 2013, Mississippi was 49th for fourth grade reading scores.
Wow.
So at one point,
yeah,
being near or at the bottom was true. But now, based off of those 2024 scores, our fourth grade readers are ranked number 9 in the nation. Based off of that average, congratulations.
Because that is a lot of hard work and dedication. Yet not only learning is a shared experience. Okay, so I know the teachers are in those classrooms working hard. You've got folks with policy and administrators who are dedicating funds and putting the initiatives together. But you also have children and their family putting in the time that's needed. So it's everybody working together in partnership.
Yeah. Having high expectations, it works.
It does.
It just takes some time to get there.
It does.
So you've been ranked number 1 in the nation for reading and math gains since 2013. Again, number 9 for reading scores for fourth graders, number 16 for those math scores are African American students. Again, fourth grade reading. The number 3 in the nation for reading and math scores are Hispanic students, scored number 1 for reading and number 2 for math scores. And then again, looking at fourth grade, our economically disadvantaged students, they were number 1 for reading and number 2 for math scores. So even those subgroups in Mississippi, like we talked about, they're actually outperforming their peers nationally. And that is not what people initially perceive or believe to be true.
Well, you can cherry pick statistics. Right. So we're looking at the statistics that the educators use.
Yes. And nationally, we're comparing our students on a national level using the same trend.
So this would be like in healthcare, people reporting health information that's not based upon anything that's a database we use in healthcare, right? Or not relying on census data. So, there are so many different surveys that you can cherry pick the statistics that suit you. So I'm glad you're bringing to the attention of our audiences the statistics important to you.
Yes.
We're going to use them.
And especially to be able to see how your state, so whatever Southeast state you might be in, is comparing to others. It gives you that common metric to see both as a nation, how are we doing, and then more specifically, how your state be doing. Okay. So here's just another example looking again at that Mississippi Marathon from 2013 to 2014. These are just some things our State Department pulled out, just some easy graphics to see that red line. That's the national trend. Again, looking at students who are scoring proficient or advanced, which is always the goal. We want them at grade level or above. For grade 4 and grade 8, reading and math, nationally, the trend is declining, going in the wrong direction. That arrow is not going the way we want it to. And in Mississippi, you see the opposite. We have seen improvements, even though nationally there's been that decline. And then again, just to see how our rankings have increased, which is not what it's all about, but it's exciting to see your work validated by that national.
Absolutely. Absolutely.
So we're really proud, but we're not done yet. So stay tuned to figure out what we're going to. Yes. So that really led to those results because it wasn't a miracle. It wasn't some magical thing.
Right.
We had comprehensive policy. And so I'm going to kind of just dig in a little bit as to what those are.
We need to, because those are part of the social determinants of health.
Yes.
That we often leave out. And our third masterclass, the one just before yours, was Scott Darius from Florida Voices for Health. And what does Scott focus on? He focuses on policy, focuses on legislation.
Yeah.
Because these are important. Those drive the distribution of resources.
Absolutely.
And that's what goes into the community to make a program possible or not possible.
Mm-hmm. Yes. So, and it's good for healthcare providers and individuals to know what policy does exist and how that's helping to improve education, and hopefully they can even follow up within their own spaces. Say, it's your child in pre-K. What are your plans for school? How's school going? But anyways, so in 2013, the first one was our Early Learning Collaborative Act, which established our first state-funded pre-K program. And then the second one was our Literacy-Based Promotion Act. And that is what made reading instruction a key focus and priority in grades K through 3. And so you can see those initial investments, they have gone up. But in all honesty, when we're talking about education funding, the dollars Mississippi has put in are relatively low compared to other states. But I think the return on investment, right, you can see it just with what we talked about. We also had some additional laws that were passed to just kind of enhance that Literacy-Based Promotion Act. Again, sometimes you have to figure things out as you're going.
Right.
And again, really figure out what are our high expectations. What are those other pieces that need to come in, again, to get this comprehensive policy? So we did add in teacher certification. So beginning in 2016, Mississippi candidates had to pass the Foundations of Reading exam.
Right.
So it's a little bit more specific to make sure you have a knowledge base and understanding of how your kids learn how to read and how to teach them how to read.
That's great.
And then we also, again, you heard me say this, but higher expectations for third grade reading. An amendment was passed in 2016, so 3 years into the act, to raise the passing score on the third grade reading assessment, as you clarify, beginning in 2018 to 2019. So prior to this, students could score in the second achievement level, but now they were required to score above the lowest 2 achievement levels, which shows that they're approaching proficiency. So right, we have, before it was a level 2, now a level 3, they must score to be promoted to 4. So again, we started, we knew where we were, we had a lot of work to do, but then we raised the expectation, and guess what? The rest through in it and achieved and surpassed. Yeah, guess. So again, we're not done yet. And I think that just goes on to say that we know there's so much more we can do. So we've talked a lot about literacy in Mississippi and the Southeast. Let's start to make those connections to health literacy or where they might actually differ. So I have some myths. I just want you to think true or false, okay? So first one, if someone can read, they are health literate.
Hmm. Well, maybe if they're reading health information, is that people would say.
Yeah.
But you've been talking about reading and you've been talking about literacy. So I would say that's literacy, not health literacy.
Yes, so it's false. Health literacy does not always equate to literacy levels or reading ability. So you might be super knowledgeable about something within the health field, but maybe when it comes to your actual literacy and individual reading level, it might not be as high as you might think it. What about being anxious? Does being anxious affect a person's ability to absorb, recall, and use health information effectively?
I would say so based on my experience, certainly working with patients and being a patient myself. Right.
Absolutely. That is definitely true. And so I want us to think about that, though. If you know you have a lower literacy level, you're in a space where you're having to do a lot of reading, a lot of comprehending, a lot of listening and communicating.
Let's say you're at an appointment. You're my provider right now, and you're talking to me about my diabetes. Okay. And you've got new information for me. And I'm already struggling with managing my diabetes. And you've already told me that I didn't take my medication correctly. So I'm anxious about now. So let's put that as our scenario here.
So literally, it affects your ability to understand, absorb, recall what your provider is trying to tell you effectively. So it's really important. And that can affect everybody regardless of literacy level.
Absolutely. Highly educated people.
Yes. I'm anxious at the doctor.
I have worked with pre-medical students, pre-nursing students who go with their family members and they're waiting in the waiting room. And then when the parent or the grandparent or family member friend is done, they'll walk out together and the person immediately turns to the pre-medical student. Okay, this is what they said. What did they say to me? Because they don't understand. So your point is well taken that even highly educated people need help.
Absolutely.
And when they're anxious.
Yes. Okay. Next one. Using plain language will make patients feel disrespected.
That's simple, not simplistic. Okay. Yes. So that's the key difference.
Yes. So that one is false. I would say clear is kind. I think no matter what setting you're in. So plain language, or again, simple language. Plain sometimes has that negative connotation when we hear that. So when we say plain, sometimes we just mean simple. It means it's clear, it's accessible, and it is respectful because you want them to understand. So it includes understanding for everybody, including the provider, to make sure you're understanding your patient is communicating to you. So important. Okay, last one. Using technology always improves health literacy.
I don't think so.
You mentioned your phone earlier, and we use it a lot, even within the medical setting. I think about when I have to sign it on my kiosk, where I use an iPad or other things. It actually can create another barrier that can be really difficult to access, depending on individual, not just literacy levels, but now you're also bringing in a whole other set of skills, digital literacy or digital skill level. So, in some ways, it can make things seem easier, but it actually can almost exacerbate stuff like that.
We're trying to expedite the process. We're not necessarily trying to simplify. We have so much to do. Yeah, we want to get it done, but you're adding more time when you have someone who doesn't read well and process information.
Absolutely, because on all of those, you have to be able to read the text on all of them to understand how to use it.
I do.
Okay, so I wanted to bring in education as a social determinant of health. We've already kind of talked about this, but we know, according to Healthy People 2030, they say research indicates that limited language skills and low literacy skills are associated with lower educational attainment and worse health outcomes. So it isn't just education, but it's literacy and language is a key part of that when we're talking about education as a social determinant of health.
Right.
And so it's important for us to understand how literacy and education impacts access to care, your comprehension of what's trying to be communicated to you about your health, and your overall well-being, because you aren't going to be able to access that information to make those informed decisions or be proactive about your health. Not because you don't want to.
Exactly.
That's the other thing. That's so important to understand.
Not competent. You're not incapable. You just have skills deficit. It's in the way.
Right. Yeah. And there's ways that we can support you, whether it is low health literacy and or low literacy.
Right.
So let's talk about that. We kind of talked about it impacts your ability to understand health information, especially if you have low literacy levels. And there's so much text that's involved. I think about both the written communication, all of the medical jargon that's used in your handout when you leave a doctor's appointment, which also includes what you're supposed to do with follow-up on. I mean, sometimes it's pages. And I know even for me, I'm like, this is a lot. So sometimes you just put it off.
Absolutely. It's overwhelming.
It's overwhelming.
And
Even when you are literate.
if you're not feeling well, or maybe you've got a new medication that's interfering with your ability to pay attention and to comprehend, because some medications do interfere. So you've got all this printed information happens that it's attacks. Yeah. And you just don't feel well. So why?
Yeah.
Yeah.
And even for those who are being caregivers,
Right.
I think that's another thing. It for caregivers who are caring for aging parents and themselves, and parents caring for their children.
Right.
They're having to do this not just for themselves, but for multiple people. So you start to think about how this just kind of exacerbates some of the lack of following through or inability to understand, or just feeling like it's just too much.
Have you ever heard the word infodemic?
No.
Oh, teach you a new word, because you're teaching us so much. So we should share with you. So an infodemic was a term coined during COVID.
Okay.
Infodemic, just an excessive amount of information, too much information, a deluge of information, more than you can manage. And it's more detrimental than helpful. And here's what we do in healthcare. We do give you so much information. If we give you a handout about diabetes, and I'll just use that as an example, everything you need to know about diabetes from A to Z is on that one handout. The font is 10-point. There are no margins. There are a few pictures. We want to tell you everything in one setting, and it's just too much.
Yeah.
So the paper overload, the information overload, it impairs and impedes our ability to practice literacy and health literacy, right? Is what you're saying.
Absolutely. And so individuals who may have low literacy skills are also less likely to receive that preventative care, and they're more likely to suffer from poor control of those chronic illnesses. So again, we think about things from understanding the correct dosage. They're trying to follow, but when you get that prescription bottle and the print's small and it is a lot of text, understanding, even including over-the-counter medication, absolutely. You have to be proficient enough to be able to read that and understand, what is it for? How can I use it? Can I use it? Should I use it? Including warning, side effects, understanding why when I took this, I took the green pill with the red pill.
Mm-hmm. Right.
I didn't understand that was going to cause drowsiness, or that I was supposed to take it with food or not with food. And just, again, it's a lot of misunderstanding,
Right.
which also can lead to medical mistakes.
Absolutely. Absolutely. And here's one that we in healthcare don't often think about, and I'm going to talk to those right now who are going to be prescribing medication. What does it mean to take early morning? What does it mean to take before a meal? What does it mean to take before bedtime? What does it mean to take once a day, or what time of day?
Yeah.
Does it matter if I take it this time one day and one time another day? That information isn't communicated in take once daily. So pharmacy students and pharmacists are never going to see this information. This is their language there. So again, it's not clear. We want to make it plain.
Okay. So I looked at this from United Health Group. And so they said nearly 9 out of 10 adults in the U.S. actually struggle with health literacy. And hey, so that's most of us. That's nearly everybody you're covering. It's not Saturday, but those of us who provide healthcare.
Exactly.
And also, again, that impacts even adults with high literacy levels, no matter what their profession is.
Right. And you know why? I'm going to tell you what, and this is something we don't talk about. It's because health as an academic subject isn't taught in school. Alyssa, you can't know health information. You can't understand your health if you don't know how your body works, and you've never been taught about health. Absolutely. In addition to reforming the curriculum with reading, need to add health back into the curriculum. You cannot have proficient health literacy if, now you might read well, you might have proficient literacy skills, but that academic subject's missing, and you can't be proficient without that subject-based knowledge.
Absolutely. And we think about that 2-gen approach too. So if your parents have low health literacy, and so they're less likely to receive that care. So you're growing up in that environment too. Again, you might have fantastic literacy skills, receive the education, but there's still that gap in understanding, in actually understanding health literacy.
Exactly.
So improving health literacy could prevent nearly 1 million hospital visits and save over $25 billion a year. Again, we'll talk about that return on investment here. It greatly impacts the healthcare field.
So we were T trillion for literacy, our B billion for health literacy, because really health literacy is applying literacy skills to the academic subject or the health domain, right?
Absolutely.
You can't do it. You're gonna lose. It's a lose-lose proposition.
Absolutely. And so if you dig into, I have this link later, but it gives you a map to kind of look at your county health level literacy level.
Right.
And then so again, we kind of see that in the Southeast, there's some pretty low health literacy levels, but there's a few pockets of hope too. And a lot of things that we can do.
Pockets of hope. That's a good phrase. And there are.
Yes. So what are some potential signs of low literacy and potentially health literacy? But I looked at these mostly from a low literacy perspective and how they impact health literacy. I like to kind of start off with even just minimal communication. So sometimes it's also body language, which I ran out of room on my slide. We could have had a few on this, but that minimal communication or hesitancy too. It can be incomplete forms or mistakes. Like if you're actually looking at the forms, simple mistakes that, they didn't just forget. We're not sure we didn't understand the question, which is maybe why we didn't answer it. Or the answer might seem kind of off the
or just doesn't seem to fit. Question.
Missing appointments. Repeated questions. Difficulty, again, we talked about this, following the treatment plan or directions, not because they don't want to.
No, it says on compliant, right, adherent.
There's a big difference.
There is.
Which impacts unable to identify medication. Again, the blue pill, the red pill, right, the whatever bottle. We're using descriptive words, not always understanding. And I think that's huge for caregivers a lot.
I think so.
Again, when you think about people who are doing this from multiple people within their family or even outside of their home, it's a lot that they're having to keep track of.
Absolutely.
And so it can be really overwhelming. Avoiding follow-up tests or referrals. Maybe saying things like, I'm going to read that when I get home. I just forgot my glasses.
That is so common.
We use coping mechanisms. We all do it. When there's something we're not good at, we learn strategies to kind of fly under the radar.
And adults don't want to be embarrassed. No one's also look incompetent.
Right. So this list is so exhaustive, and we'll probably think about other things, or even think about, well, I saw that, but maybe it wasn't low literacy. It can be something else too. But just wanted to put this on your radar. So what can we do? There are things we can do, Laura.
Right.
So we have some strategies to improve literacy and health communication. These are just simple things that you can implement in your daily routine. And like you said, those habits you're building for our students in school, these are those habits that you can kind of start to build now.
Right.
They don't take necessarily a ton of extra time, but really think about simplifying your communication. using that plain language, not just spoken language, but in your written communication as well.
Right.
I think that's super important. Slowing down. This is something I even need to probably work on right now. But just slowing down.
Right.
Doesn't mean to yell and be louder, but you just slowing down, like repeating information.
Because it's new information to your patient. It's information that we live with and talk about every single day. But for that patient at that moment, it's new information.
Yeah, they might be lacking what we call the background knowledge.
Exactly. Or because it's harder
For it to stick.
Well, again, we're not learning about health in school, so you don't have any place of reference.
That baseline.
You build layer upon layer. You show basic and you add more complex information. And so where does this person input and start to build?
And make those connections that actually help them retain this information and then have it in a place in their long-term memory to be able to recall and retrieve it and use it.
Exactly.
There's a lot of steps that go to that, and leave it at the reading brain. I could go on and on. I do want to differentiate, though, between English proficiency and health literacy, but even just literacy levels. So just consider the language needs of the individuals you're working with. If you're not proficient in the English language, it does not always mean that you have a low literacy or health literacy. That's correct. So they actually might have literacy skills, but the language is a barrier for our communication, not always indicative of those. So I like to put that out there. Now, again, it could mean low English language proficiency, and then you think about, okay, well, what am I giving them? Is it in their language? Exact. So medication can with everything. Again, we start to get, doesn't mean they might be incredibly literate. That's not a thing.
Right.
Well, they're not proficient. So we have to think about that at all of those points of interaction.
Sure.
And make sure that we're providing a translator or the tools necessary to make sure that that's not a barrier.
Right.
Okay, I love this. I use this in the classroom too. Again, that's my experience. But using open-ended versus closed-end questions. So closed typically have limited answer options, yes, no, one word. But open-ended questions are a lot more, you get more bang for your buck. And so, for example, I'd like to hear, tell me, how have you been doing since the last visit? Now, you could just say good.
Right.
But it's a lot harder to only use one word. Yeah, it is. Well, I've had this then. And even if they're not always talking about health, you get some insight into kind of what's been happening. So, what do you know about managing your diet?
Right.
So then you can correct maybe some misconceptions, that you know what they do understand or what they think they understand. Gives you insight into their actual health literacy.
That's an important point of distinction, that they fit right.
Thanks. Instead of saying, do you have any questions? What questions do you have?
Right.
Also let them know you want to hear from them. It's abiding. It changes even just that relationship and perception between provider and patient.
So, and if they say none, that's often a clue that they have low health literacy because they have no questions. I will tell you, a patient with no questions is a patient you should be concerned about because they either are not reading well or they don't have proficient health literacy. So these should be a ideal question, at least one.
Yes. When will I see you next? When do I have to come back? What do I have to do today?
Exactly. Yeah.
Did you say this or that? So on that note, this is also really interesting. Up to 80% of the medical information patients are told during office visits is forgotten immediately. And nearly half of the information that they retain.
Correct. And I shared this with a physician recently, and she blinked and said, I spent 62 minutes with a patient. And she said at the end of the conversation, they looked at me and they said, so what do I need to do? So what you're saying is exactly right.
Yeah. And it goes back to how are you communicating? Are we sometimes, again, we think we're doing a good job, but it's not about what we think we're doing.
Right.
What's most important is, did the patient understand? How are they receiving it? How are they understanding? So taking that time to do that to improve our communication and the patient's comprehension so that they have the opportunity to improve their health literacy and apply that information and be independent and proactive and take a step in managing their absolute. It's so essential. So also knowing visual communication aids can be especially effective for those with low literacy. Sometimes video or multimedia things can actually, it can be sometimes harder for them. So really making sure that we're using the inhaler, let's bring out the inhaler and show them. Let's do it together.
And then let them show me.
Right? Yep.
Yeah.
So the Agency for Healthcare Research and Quality, they actually have a health literacy universal precautions toolkit. And I encourage you all to take some time to dig through that. There's 23 simple tools. Again, and I do mean that, they're simple. And sometimes you read it and you're like, well, yeah, that just makes sense. But we don't always do it. So it's important to not be like, well, yeah, I know that. But actually reflect on, oh, have I used that?
Have I ever actually used this tool? I use this toolkit in my teaching all the time with medical students. And so here are a couple terms you didn't know, but they're going to speak to the two audiences that we're going to be meeting with. So the tools will improve communication skills to improve patient satisfaction, which is part of a measurement that we all get now in these days of high value care. Also, the patient experience is improved. So reimbursement, okay, for our services is not fee for service where you come see me and I just automatically pay you. Now we're asking patients about their satisfaction, about their experience, and reimbursement is going to be influenced by what they say. So folks, the Universal Precautions in Health Literacy Toolkit honestly is invaluable, and at whatever stage you are in your career. Yeah.
Absolutely. And again, it goes into strategies for simplifying your spoken and written communication. Again, things that are going to help patients be able to self-manage and empower them again. So it's really focused on that patient experience and patient outcomes, right? But they're super simple things that you can do. Even goes into kind of thinking about systems change, which I'll allude to. So what are some of the strategies? One of the gold standard ones, we also use this in the classroom and education. You teach FASA, so you use that. Yeah, do your students? I do. Calm checks for understanding is one term, but methodically, that is the teach back method.
Right.
So I just have some examples here. I want to make sure that I explain things clearly. Can you explain to me?
Right.
You already know, but again, it's new to them.
Right.
Let's, where there might, yes, they got it, or there's a gap in understanding somewhere, and then you can respond in that moment. I want to make sure I've done my job well and explain things clearly. If you will, tell me back the plan we just discussed. I'll type it up and send it home to you.
Right.
We're doing this together. I'm guessing a family member. I think about this one a lot. I'm guessing a family member may ask you what you found out at today's appointment. What are you going to tell them?
I love that one. I do. I love that one.
For who often come by themselves too, or have family who live far away. That's a lot of feedback.
And again, it doesn't put them on the spot that I'm testing you. That's the key.
It doesn't feel like you're imposing,
right?
From the patient side. Would you please show me how you're going to use your inhaler so I know if I explained it well enough? Except you're putting it back on yourself if there's a gap in understanding. Okay, you're right. I probably should have done a better job of that. Real quick, you can correct it. And now we can use DB. Right. So it's kind of that show me to additionally, think about your system. So we kind of talked about this. When they come into your medical setting, how difficult is it for them to navigate? I think about this as myself. Going to a new place, I think a lot about the parking location. It causes me a little anxiety.
Yep.
But what happens if you have low literacy? So they have to find their location. So using a map. Potentially, I know we have GPS on our phone that can talk to us. But if you can't read the sign, you might miss it.
Absolutely.
Where am I actually supposed to possibly am I not? Where's the actual entrance I'm supposed to go into? And then again, you have those digital systems. They often have to navigate. it's going to go in your portal. Okay, well, I can't access my portal. So I actually didn't receive the house care instruction, which is why I didn't do them.
And what you're talking about is called organizational health. It is an important piece of that health literacy construct, which is all part of the literacy
language. So, and again, we want to connect them to those community resources to support adulting with low literacy. But also, I really wanted to include this part, Laura, supporting families with children, to make sure that they can develop strong literacy skills in their children.
That's great.
So, when you're working with, whether you're in pediatrics or working with family, or a patient brings in their children with them, it's an opportunity for you to see how is that whole family supported, and especially their children, make sure they're on the right track.
That's great.
So what are some of those resources? So referring patients to community resources and program, I listed just a few possible ones here.
That's real. You have a very helpful list here. Yeah.
So the Campaign for Grade Level Reading is a national network of communities that are actually working on the ground in the local communities to rally around schools to improve literacy outcomes for all students. So they're very invested in their community. They focus on 0 to 5 through 3rd grade, and they're working with families. So sometimes they have organizations, partners, initiatives that they're doing that might support not just your patient, but families with young kids learning too. The National Literacy Directory, this one was actually new to me, but it's a database to locate programs within your zip code within a certain number of miles. So you can kind of set that. You could pull this up with the patient real quick, or even just for your own research, see what is in your community. Might help with reading, writing. They want to help their children learn. If they're interested in learning English, if they want to become a citizen or find family literacy programs or study for their high school equivalency exams. This literacy database, those are all the kind of search features, and you can pull that up for your own community and see what's out there.
And this is new information, so thank you for sharing it with me.
So that's a first stop, easy to create your own person.
Absolutely.
Public libraries. Again, often we don't think about them. But they will probably be so impressed if you picked up the phone or sent them an email and asked them for, hey, I'm interested in this. What programs do you offer? Your local school districts and even community colleges. There's a lot more happening there than you realize. Local nonprofits. And then also, if you are in pediatrics, becoming a reach out and read site is a great way for you within your practice to kind of come alongside and be an ally to support families. So clinicians use books and they promote shared reading at their well child visits. So it's that point of contact, improves that patient satisfaction experience, supporting the child. And is also the only literacy model that's endorsed by the American Academy of Pediatrics. So in conclusion, again, I think we kind of hit this home.
Yeah, but we have.
Literacy is important because it impacts outcomes and especially health. It's gained a lot of national attention. Our Mississippi Literacy Marathon has led to notable literacy gain, but we're not done yet. We know that literacy and education as social determinants of health impacts access to care, their comprehension, overall well-being. Healthcare providers have an obligation, in my opinion, to understand what those signs low literacy may be and to implement simple strategies to improve literacy and health communication. And also take the time to connect with some of your community level resources to support individuals with low literacy levels. There's a tremendous opportunity for collaboration between all of our sectors to work together to collectively improve not just literacy outcomes, but also health outcomes for everyone. So I have a few resources here too that are linked. So as you kind of take some time and want to learn more, I really encourage you to check these out, including that literacy gap map. You can view state and county level data. It includes health and some other literacy metrics. So really encourage you to look at those, share them with your teams, and then just know that we all have this role to create a more healthy.
Wow.
So
thank you.
Absolutely, Laura. It was my pleasure and really exciting to be able to talk about this. So,
well, I think you certainly given me some new resources, and I thought I was pretty on top of everything. I know that you've given our audiences a lot to think about and a lot of information that's going to improve the quality of their care, which is exactly why we invited you here. So everybody, I hope you enjoyed this presentation, this masterclass focused on literacy, and I'm hoping that you can see why it's important to think about literacy and all the literacy skills that Alyssa took time to mention when you interact with your patients. Please plan to join me, stay with me for masterclass number 6, which actually is going to drive home a lot of these concepts, Alyssa, that you just talked about. So masterclass number 6 is prepare, activate, engage, a 21st century checklist for appointments. I will be giving that presentation. So again, everything you've talked about are going to drive 10, absolutely. So I'm just going to share with those who are part of class that class is now dismissed. Bye-bye.